You know, when we first met in 2013, you introduced yourself as the pot doc, which is something that it's still stuck in my head.
I think I said sometimes patients call me the pot doc.
Yeah.
I probably wouldn't have adopted that moniker myself.
No, but you seemed welcoming of it.
I didn't mind.
I didn't mind it. How have things changed, would you say, over the last 12 years or so when it comes to cannabis?
I think things have changed immeasurably. There is a universal, or seemingly almost universal, acceptance at this point that cannabis or cannabinoid-based approaches to things like medicine and therapy are alternatives for folks where we didn't used to think of them as options before.
One of the areas that you seem to be focusing on now is women. Why women's health?
So women are largely underserved and underrepresented in medicine. We know this. And when it comes to things like chronic pain, for example, which is generally almost always the number one indication for medical cannabis use depending on where you are in the country, women suffer from chronic pain conditions more often than men. There are studies that suggest that women are more sensitive to pain, and yet they are often underserved with conventional medications.
When it comes to pain again, and specifically with women, things like endometriosis, is that a viable area of study?
And we actually have a clinical trial focused on exactly that, for that specific reason. So when we think in the big picture, gynecologic pain affects more than 1 billion, with a B, women worldwide. When we think of endometriosis, something like 1 in 10 individuals will have endometriosis. And for the folks who have endometriosis, they are often debilitated. They can't live their lives. They lose sleep, they lose productivity because they can't go to work, and conventional medications don't necessarily do the job. And so when you see people trying cannabis or cannabinoid-based therapies and saying, hey, this is more helpful than the NSAIDs I was taking, there's got to be something to it.
Let me share something with you that I learned in Tulsa. You know, we spent a week there. There's this woman, April Ayers. She was a former real estate person who decided to transition to the cannabis industry. She's in her mid-50s. She told me that her dispensary, which is called Cowboy Kush, the average demographic is a 54-year-old woman that comes in there. It's an all-female staff, and one of the nights that I was there, everybody that came in was a woman, and they were there for sort of this learning seminar on cannabis for women. I'm just curious your top-line thoughts. Is something happening with regard to women in weed?
So I think that women are, again, vastly underrepresented in both the cannabis industry and in terms of the actual patients or the cohorts that people are trying to treat. But they're often the people who need the most help. And so that is beginning to change. People are much more willing to come forward and say, I want to try this, I want to try that. There are many more women now in the cannabis industry. And women in the cannabis industry are invested in helping other women understand the whats and the whys and the hows. And that is a game changer for people. That's really something when we think about the lack of education in the general public and specifically with healthcare providers who don't know much and who will tell, most responsible healthcare providers will tell their patients, I'm not sure I know enough about this, so we may have to recruit other folks to help fill in the blanks.
Many of the women there, again, 54-year-old being the average age, were coming in for hot sweats and night sweats and hot flashes and headaches and mood disorders.
Sure.
A lot of overlap with the reasons people took cannabis in the first place.
In the first place, exactly.
But a very specific demographic of people. Where do you think this goes?
In terms of the future?
Yeah, do you think recently, as you may have read, the black box warning on hormone therapy got lifted?
Of course.
It took 25 years. And it makes sense in so many ways if you look at the data. But I think part of what we were seeing is that there weren't a lot of great options for women, especially during this phase of life with menopause. What do you think is driving the interest of women when it comes to cannabis?
I think that when we think of menopause and the things that, again, the top 3 or 4 things that affect women in terms of hormonal dysregulation, again, mood dysregulation, sleep disruption, chronic pain, aches and pains. People will tell you, I have aches and pains in places and spaces I didn't know I had. And so it echoes exactly what we see in the sort of across the cannabis landscape anyway. And people are now much more invested in exploring things that may be helpful and not harmful to them in the aggregate.
One thing that surprised me was the use of cannabis during pregnancy. And I just want to riff with you a little bit here because I sort of am working through this myself. The idea that, you know, you can develop significant nausea, vomiting during pregnancy, you can have significant pain, mood disorders, all the same things that we talk about with cannabis, those things can get amplified during pregnancy. At the same time, we think, God, that doesn't sound right. The idea that a mom might expose a developing baby to cannabis. How do you think about it?
I think about it as a very, very challenging topic. And I think, again, cannabis is not one thing. Some of the folks that I've spoken to who choose to use cannabis or cannabinoids while pregnant are using things that are high in non-intoxicating cannabinoids with maybe just, quote, a scotch, if that's a term, of THC. That's usually where they are. Other people will use products that anybody uses for recreational purposes. They take a hit or two. It's challenging because there is some data clearly that suggests there are negative effects to the unborn child. It really depends on what you're using, how often, when, so many things.
Based on what we do know about cannabis overall, is there anything to specifically say about cannabis in pregnancy?
I don't know that we have all the answers yet. There's been a fair amount of investigation in this particular area because people in different parts of the country, there are particular demographics, I think, that are affected and that come forward and talk about their use of cannabis and cannabinoids. This was the only thing that got me through, but I think we don't have all the data. We don't know everything.
Had you heard the term Canamom?
Yes, I have. Yes.
So what is a Canamom?
It's sort of like a soccer mom, but at the end of their day, they may go home and instead of having a cocktail or something else, very often Canamoms are those who have decided to turn to cannabis or cannabinoid-based therapies instead of alcohol.
Do you think that's been driven by the decrease in stigma, the dissatisfaction with alcohol?
Yes.
All that?
I think the Surgeon General coming forward and talking about the relationship between alcohol and cancer changed, again, the nation's perspective of alcohol. There was a sort of a collective rut-row. Now what? We need to have something. And so, THC-infused beverages or cannabis-infused beverages became incredibly popular. You could find them everywhere.
There's a study from the University of Michigan which has found that women between the ages of 19 and 30s or so are now a larger user of cannabis as a demographic than men. Does that surprise you?
It doesn't really surprise me. I think that, again, women are more likely to lean into things that will help them with multiple aspects of their lives day to day, whether it's taking, quote, the edge off at the end of a day, or to address sleep disruption, mood dysregulation, or chronic pain.
When it comes to the Women's Health Initiative, what are the big unanswered questions for you?
So for us right now, I think one big unanswered question is how best to leverage some of these non-intoxicating cannabinoids with certain terpenes to give individuals real pain relief, where you can change the trajectory of someone's life as opposed to just living with being completely debilitated for 3 or 4 days of a month. And that's really truly what happens to people. They will tell you stories where they have to physically pull a car over because they can't drive anymore. They will tell you they missed their daughter's first recital. All of these horrific stories that don't sound terrible on their own, but in the aggregate are a game changer and life-changing.
Where do you think this era of women in weed goes? Does it continue to grow, do you think?
I do, because so many are in need. It's really, again, when I think of the number 1 billion worldwide have gynecologic pain. That's an astounding number of people. And if there's a possibility for a fraction of those individuals to be helped and not necessarily introduce tremendous harm and risk, we should be exploring that. Women are increasingly more inclined to speak up and to be seen, to be heard and to be treated. A lot of people don't come forward and say things like, I actually have been suffering terribly with anxiety or depression. My husband doesn't know, my kids don't know, I can't let anybody know, but quietly I fall apart every day at X o'clock. And since starting this, I don't have that anymore. It's a game changer.